Want freedom from disease? If you're like me, you know that if you don't have your health, you don't have much else. Do you want freedom from disease? On the 4th of July, 2 women shared a hospital room. Both had been diagnosed with diseases. Sandra, a brunette, was being treated for celiac disease. The blonde-haired, blue-eyed Barbara was being seen for a recent onset of pulmonary hypertension. Given the time to visit, both women began to express their common dissatisfaction with not being able to attend the 4th of July festivities with their families. The women also discovered they shared something else in common. Are you prone to disease? Within the last 4 years, they both had been prone to contracting many diseases. The women exchanged their phone numbers. 3 years later, Sandra called Barbara. She felt fortunate to find she had kept the same cell phone number, as Sandra's number had changed since they exchanged numbers. Sandra had decided to reach out to Barbara because she felt the end was near for her, and she wanted to visit with her again before she died. Barbara remembered the brunette from the hospital and was sorry to hear that Sandra's successive diseases had worsened. While Barbara was happy to be disease-free, she had been diagnosed with Lyme disease, which was probably what she had all along. I too was prone to disease. Do you know anyone else who's prone to disease? Have you ever been misdiagnosed? While her symptoms seemed to change at will, Barbara had been diagnosed with a variety of diseases which matched particular diagnoses. When the Lyme disease moved to another part of the body, this would create a different set of symptoms, and she would be diagnosed again based on the new presenting symptomology. It wasn't until she was diagnosed with Lyme disease that she could focus on it and was able to defeat the disease which had targeted her. If you're like me, you know how hard it can be to be stuck in the doctor's revolving door of misdiagnosis. Ever feel the pain, frustration, and depression? Sandra felt as though the end of her life was near. She had taken about all she could take of suffering from so many diseases, one after the other. She felt like she could no longer deal with the pain associated with each disease, and some were worse than others. Frustration with family and friends who had tired from hearing about all her complaints and discomforts and had fallen into a dark depression. Lately she had hoped that the next disease to rear its ugly head would be the one that would take her life once and for all. Have you had suicidal thoughts? Sandra thought if the next disease did not take her out, then she would do it herself, and she had come up with a plan to take her own life that would not leave too much of a mess to clean up by her loved ones she would be leaving behind. She felt as though death might be the only hope for escape from this life of endless disease. What if there was hope for you? Barbara suggested the idea of considering that maybe Sandra was suffering from Lyme disease just like she had. Of all the diseases, Sandra had not been diagnosed with Lyme disease, probably because she had never had the occasion to be bitten by a tick. Barbara told her there are many ways to contract Lyme disease that have nothing to do with the tick, just as she had not been bitten by a tick. She said she had found she had Lyme disease by a simple, inexpensive, non-medical diagnosis and had eliminated it altogether. Even if Sandra did not have Lyme disease, just the enthusiasm behind Barbara's story gave Sandra hope. Hope that she, too, had Lyme disease, and she could respond as well to the subsequent treatment just as Barbara had. What if you could have freedom from disease? That phone call was 3 years ago, and nearly 7 years since the women had met on that 4th of July in the hospital. This year, both women will be celebrating with their families, each of them the image of good health, wellness, and experiencing freedom from the disease. They are ecstatic about having their lives and family back intact and are celebrating life with every breath they take. I met Sandra and Barbara at a recent Victims of Lyme Disease conference, and their story about being driven crazy, getting depressed, and feeling like death might be the only way out resonates with my own story. I had been diagnosed and treated for so many diseases, I could hardly count them. and I had several plans about how I might commit suicide myself, as the only way to find my freedom from disease. Want help? We all decided to answer the call. The call to help others who know what it's like to have suffered what could be considered to be medical abuse at the hands of well-meaning doctors and clinicians who are trying to help people, but are only making things worse for those who suffer from Lyme disease. Not only do we have first-hand experience with slaying the Lyme disease dragon, but we have taken the Lyme disease course, which was created for physicians and the medical community at large. Take the Lyme disease course. While we, each of us, found healing in different ways, the Lyme disease course delineates not only traditional treatment, but unauthorized alternative treatment modalities as well. Whether you're a doctor or work in the medical field, know of someone you could help or could use a little help for yourself finding freedom from disease, this Lyme disease course is for you. You will learn how to diagnose and treat Lyme disease, as well as be educated in the various methods of alternative therapies, which you may either consider to avoid, guaranteed, so there is no risk for you. This information is priceless and will open your mind to the many possibilities in finding freedom from disease. If you have any questions, you can speak to a live person from Leading Edge University by calling 360-748-4426.